G'day folks, it's Min Lakong here of the Pre-Hospital Retrieval Medicine podcast. I'm putting in the PK SMAC 2013 entry, and my topic is Macgyver non-invasive capnography, and I thank Dr. Adam Pritchard who helped me with the preparation. Okay, let's get on with it. So the objectives is to demonstrate an improvised non-invasive capnography setup for aeromedical retrieval environment and to highlight the advantages of such monitoring setup for procedural sedation in flight. So procedural sedation monitoring is done in the emergency department. It's also done in the pre-hospital retrieval setting, and here's some medications that I drew up for one flight that I did. So we do it for a number of reasons, but we won't cover that in this talk. So what if you don't have a formal non-invasive capnography device? So this is what we use in the Royal Flying Doctor Service Queensland section in Australia. We use an American-made device called Mainstream Capnography Sensor by Protocol Systems. I have no financial interest. So it's a Mainstream device which is attached to your endotracheal tube, and there it is in its box. It connects to a Welch-Allyn ProPack, which I'll show you, and the sensor device is actually this component here. And you see I've taken it out there. It's got an endotracheal tube adapter that you plug into there that's disposable, and it plugs into your Welch-Allyn ProPack device. And you can see that an endotracheal tube here is fitted onto the end of the device, and then the rest will go into your bag valve mask or your ventilator circuit. So what if you don't have a formal non-invasive nasal prongs or so that you could connect to your monitor? Well, you can get this same Mainstream device and you can cut a hole into a face mask. Here's a non-rebreather mask here, and you can then insert the end of that endotracheal adapter through the mask there. You see me here modeling, and this is when I was in my facial hair days trying to emulate Scott Weingart. But you can see here, this is the waveform that you develop with a nice capnography value and waveform. This is Dr. Adam Pritchard, an ex-registrar resident friend of mine who's now graduated, but he is demonstrating me in this setup here of pretending to be sedated, and this is the waveform that you get. We also were running 6 litres a minute of oxygen, just demonstrate that it will degrade some of the waveform. So if you compare it with this one where there is no oxygen versus this one where there's 6 litres, you see that there is some degradation of the waveform, but the value actually doesn't change much at all. And this is a further demonstration at 10 litres a minute. You see there's significant degradation of the waveform with some reduction in the measured end-tidal CO2 value. Here's simulated apnea by my colleague, showing obviously a loss of CO2 tracing. Here he simulated hypoventilation with low, shallow breaths, but you can see that that nicely illustrates a change in the waveform. So this is to simulate a sedation effect, having an effect on someone's ventilation. And then you see he simulated apnea with a resumption of breathing. So why is this a big deal? Well, we on retrieval we have to sedate patients at times, sometimes for agitation reasons. You see this patient here is on 80 milligrams an hour of ketamine infusion at 20 mils an hour, but the total dosage is 80 milligrams an hour of ketamine. You can see we're doing non-invasive capnography there with nice vital signs monitoring. In the aircraft, this is in the back of our King Air, Super King Air twin turboprop fixed wing retrieval aircraft with a LifePort stretcher system. You see that the way that we're positioned, the nurse and myself here in the front foreground of the picture, we can't actually see the patient's chest wall rise that easily, but we can see the end-tidal CO2 trace quite easily. And this is a close-up of the monitoring flight with a nice end-tidal CO2 trace. So in summary, I believe there's a crucial role for capnography in pre-hospital retrieval sedation monitoring, and that you can have an improvised non-invasive capnography setup using your usual Mainstream end-tidal CO2 sensor and system, and it's practical and effective. My disclaimers are I provide this demonstration presentation for education purposes only, and I have no financial disclosures. Medical professionals need to use their own clinical discretion for patient care decisions. Thank you very much.